Children and young people with mental health problems have been let down by successive governments over the years, and two influential committees of MPs say this government's latest strategy to help them is failing too. One area they've raised concerns about are the issues young people face when transitioning from child and adolescent mental health services, known as CAMS, to adult services at the age of 18. It's estimated about a third of young people completely drop out of mental health care during that switchover at what the Royal Society of Psychiatrists says is a particularly vulnerable time. So, should young people's mental health services be extended until the age of 25? It's one of the recommendations from this joint report today. Let me introduce you to Chloe Shelton. She's 21. She has anorexia and anxiety. And she says she was left in limbo when she transitioned from children's to adult mental health services. Also with us, James Downs. James has bulimia. He's also had anorexia and depression. He's now 28 and he thinks he should have been treated by CAMS until he was 25. Also with us, Dr Jon Goldin, Vice Chair of the Child and Adolescent Faculty at the Royal College of Psychiatrists, and Luciana Berger, Labour MP and member of the Health and Social Care Committee, one of the two committees who've criticised the government pretty severely today. Welcome all of you. Thank you for coming on the programme. Chloe, let me start with you. I wonder if you could give some insight into our audience about what happened to your support when you hit 18.
So basically, I was first in CAMS when I was about 14 years old. I didn't have the best experience there, and just as I started to head towards my 18th birthday, after the worst sort of my anorexia became stable, I had a really, really great therapist. My psychiatrist was lovely, and all of a sudden, after years of trying to find a therapist that worked and was actually understanding me, I was told, well, you're 18 now, so you're ready to move on. I wasn't ready to move on. I'd had about 3 years of not being, I wasn't as mature as I should have been at that age. A lot of people tell me I have a lot of life experience and all of that, which I do, but in that respect I was not mature enough to cope with that change. As I was given the letter to say I was moving, I then spent 3 or 4 months of not having any care, any help or anything. Bearing in mind I was only just in remission at this point, I was still very depressed, and it was a complete mess. They didn't support me at all, and then when I did get picked up by them, I felt that I needed to prove that I still needed help and I still wanted the help. Yeah. So then obviously you have to repeat your story all over again, and they have to try and understand you and know who you are, of which a lot of the time they can't understand because they don't know you. Sure. I then stayed there for about a year or so where I tried to engage in therapy, and again didn't get on with them, and basically since I've moved to adults I have been allowed to slip through the net even more so than I did at CAMS.
I'm going to bring in James, Chloe, who believes that the age threshold should be raised to 25, but actually it's worth telling people, James, when you were a teenager you were told by CAMS and the eating disorder team you better get better before you're 18 because that's when things can go wrong.
Yeah, and I think the age isn't actually so relevant. I think it's just having the support to wrap around you, whatever your age, whatever circumstances you're going through in life, and to have, to hear Chloe's story about the support just dropping away when she needed it, when she just got it, and then having to prove that you were ill again, maybe, becoming even more unwell before you could get treatment, that really rings a bell with me. But I think I had that experience of CAMS saying, you better get better. It was a bit of a scare tactic, saying that if you don't get better then you're going to have nothing. And that wasn't the best motivation for me. I needed a positive reason to get better, not some kind of scary story about something awful that was going to happen. But they did keep me on a little bit longer until I was nearly 19. Yeah. And at that point they discharged me, and it was completely up to me whether I wanted to go to adult services. There was no communication between child services and the adult services. And I'd been really critically unwell with anorexia, and I think to just go to nothing, I shouldn't really have been allowed to just go to nothing, even though I had the capacity to make that decision, and I was viewed as, an intelligent person who knows what I'm doing. I think that there should have at least been a conversation about, do you actually need more support? And there was this big shift in the approach in the therapy from suddenly, instead of being looked at as a part of a family or part of the school and being situated in an environment, suddenly you were all on your own and you had to make this decision for yourself. And whether you were still living at home or whether you were going to university or whatever, didn't really matter. And I feel like, yes, I had the right to decline treatment, and I kind of wanted to slip through the net, but it was so easy to slip through the net.
Understood. Luciana Berger, one of the recommendations in the reports today is that we move this threshold to the age of 25. Why would that be better? What is the difference between 18 and 25 if you have an eating disorder or depression or anxiety?
We heard from many experts during the Select Committee evidence sessions and also from young people themselves. And we know already it's so challenging for young people to get into services. Public Health England tell us that only 1 in 4 children that need help actually get it. So once they actually get into services, we've got these very high thresholds that people have to pass in order to get in. Sometimes that can take them very, very close to their 18th birthday. And as we've very eloquently just heard, that then means people have to repeat their stories and go through it again at a time which is for lots of young people is a precarious time. It might be that young people are transitioning from further education into higher education, into employment or training, and we have to do everything possible to equip young people and to treat them when they're younger rather than wait until they get to their adults. So we know that the majority of adults with a diagnosable mental health condition will have developed it as a young person. And so ensuring that continuity of support earlier on, I think, will reap so many benefits, not just for those young people themselves, but also for the NHS and for the country as well.
I've got an email here from Matt who says, I was treated for ADHD from the age of 9. At 18, I left home for university, and suddenly all the support was taken away. I went from quarterly checkups with an ADHD specialist to just GP appointments, and then I waited 6 years to get adult specialist help. I feel totally let down. I want to ask you, how rare are these cases of Matt's and James and Chloe's, or is it pretty common?
I think sadly it's pretty common. The way services are organised at the moment, CAMS, Child and Adolescent Mental Health Services, tend to go up to age 18, and then I hear from a lot of young people that they feel like they're going off a bit of a cliff edge at the age of 18. So CAMS services are holistic services, multidisciplinary services. We very much think about the system around the young person, their family, their school, their university. And in adult services the focus is sometimes more on schizophrenia, bipolar disorder. Our adult colleagues do an excellent job, but they don't focus as much on sort of developmental aspects as CAMS services do. And young people are at a vulnerable stage between 18 and 25. They're leaving home, they're starting university. We know that university students have increased risk of mental health difficulties over the last few years.
So would you support the recommendation in the report to move it from 18 to 25?
We would actually, we would, and we think that would enable a sort of smoother transition and more support for young people with, such as James was saying, with eating disorders, depression, anxiety. I could also mention autism spectrum disorders, which, often in adult services they're not such good services, but if you had the continuity up to age 25, that would help.
I'm going to go back to Chloe in a moment, but Luciana Berger, you've really criticised the government's plans for young people and mental health services in the future. We obviously invited a minister from the Department of Health onto the programme. They weren't able to come, so they gave us this statement. We completely reject any suggestion that our plans lack ambition. These changes that we're planning will transform mental health services for children and young people. We agree that every young person should be able to access mental health support. However, we need to ensure we get this right, which is why we will pilot our approach to make sure services are correct.
I think it's very disappointing that we don't have a government minister here to answer the questions that I'm sure everyone on this panel wants to put to them, because as we rightly set out in the report today, this plan as they've laid it down at the moment is going to fail a generation. And I don't think we make that claim lightly. It's in the wake of the massive body of evidence that we've heard. The resources that they're going to put in is only, under the pilots, going to reach between a quarter and 25% of children, 20 to 25% of young people by 2023. That's hundreds of thousands of children across our country that are not going to be reached by their plans. The money that they're going to put in is only guaranteed until 2021. So, and with an unspecified level of success in terms of when that money may or may not continue. They only seek to roll out the whole programme up until 2030. So we've got a massive gap here, and there's nothing in the government's plans, nothing to actually contend with how we prevent mental ill health in our young people in the first place. Nothing for the under fives.
And have Labour got plans to address that?
Most certainly, and particularly to address that imbalance between what goes into our young people's mental health services, which is about 10% of the overall mental health budget. But critically also, and it's one of the questions that I put to the Minister, is how do we tackle inequalities? Because this is a massive social justice issue, and actually what we know is that young people from the poorest backgrounds are up to 4 times more likely to suffer with their mental health at the age of 11 compared to those children from the least deprived backgrounds. And again, there's nothing in the plan to deal with that. Looked after children that are in the criminal justice system, excluded children, all of those things missing from the government's plans.
It's really astonishing to hear the government defend what they're doing, because I think 20-25% of people to be reached is really unambitious, and the costs for the other people who are not getting reached are just too high. We can't tolerate that, and I just think there's a failure to understand what investment actually means. Investing in something, you get a return. If you invest in something, it should be the health of young people, and the benefits will be so great for the economy, for all kinds of things, but also for reducing human suffering. I think, if I had early intervention, I would have been in work much sooner, I would have been paying my taxes, and there's a clear economic argument that just makes sense. But I think even if it did cost money to help young people to live healthy lives, then it's something that's worth paying for.
Chloe, final thought to you. You say you slipped through the net, and as a result, I think you believe that's why you failed your A-levels, you didn't get to go to university, you lost jobs, friends and family potentially.
I was critically ill for a very, very long time. Had I been treated when I was a lot younger, then perhaps I would have been able to go to university. I was actually taken out of my A-level year because I had to engage in inpatient from home treatment. And unfortunately that did mean that I didn't achieve all of my A-levels. I slipped obviously through all of that experience. I had to find my own way to uni, so I'm an open university student. But again, it's so difficult because that support's not there anymore. I have to rely on my GP, who is brilliant, and my family to support me when I'm not well. Okay. And it's just so unfair. And to hear people say, hear the government say that they need to support certain different aspects, they're not supporting anybody. I don't know anybody in mental health treatment who can hands up say, I'm being treated properly, or things are going well for me. And especially with eating disorders, it's shocking.
Thank you very much, Chloe. Thanks for coming on the programme. We appreciate it. James, thank you as well. And thank you, John and Lucy Onneberger.